Hey guys, how's it going? So today we're going to be talking about your acid-base disturbances that can occur. So in regards to your respiratory system and your metabolic system as well. So respiratory acidosis and alkalosis, as well as metabolic acidosis and alkalosis. And we're going to go through some quick mnemonics to know how to easily identify conditions that can cause any of these disturbances. So starting with the respiratory system, you can have respiratory acidosis. Okay, the mnemonic to remember in this case would be the mnemonic to remember in respiratory acidosis would be A cow. Okay, so A would be for airway obstruction. Okay, for the other A would be acute lung diseases. Okay, for C would be chronic lung diseases. For O, it would be opioids and sedatives. And for W would be weakness of respiratory muscles. Okay, so in respiratory acidosis, you would have an acidic nature, so your decreased pH, and you would have, because it's to do with the respiratory system, you would have increased levels of CO2, carbon dioxide. CO2 is an acidic substance. So if you have increased levels of CO2, you're creating an acidic environment, which means the pH would go down. So in these cases, you have trapping of CO2 in the respiratory system because you're not able to push that CO2 out effectively. So in cases of such as opioids and sedatives, you would have things like due to the inhibition of the respiratory center in the brain, your ventilation is impaired. Therefore, your respiratory rate is low. If your respiratory rate is low, you're not ventilating enough, so you're hypoventilating, okay, which would cause more CO2 retention. Okay. Chronic lung diseases, important disease to note, would be COPD, for example. Okay. So this is how to identify respiratory acidosis. Respiratory alkalosis now. So with respiratory alkalosis, okay, the mnemonic to remember would be pushed. So as we said, respiratory alkalosis in respiratory systems, CO2 is a major player. So with alkalosis, you would have an increased pH, okay? And in this case, because we said carbon dioxide is an acidic substance, you would have low levels, okay, of CO2. Low levels of CO2. Okay, so what are some examples? So it would be pulmonary embolism for the P, okay? For A, it would be anxiety or panic attacks. Okay. For S, it would be salicylate toxicity, but early salicylate toxicity. Okay. For H, it would be hypoxemia, so such as to do with high altitude. Okay. And for T would be tumors. In these conditions, you would be hyperventilating. Your respiratory rate would be increased. You'd be pushing more CO2 out of your system, which would eventually cause lower levels of CO2 in your system and an increased pH. So things like hypoxemia, such as in high altitude where your partial pressure of oxygen is low, you would be wanting to breathe more and more because you're not getting enough oxygen. So you would start ventilating more and more, which would cause more CO2 to be expelled. So you would end up resulting with a increased pH and a decreased CO2 level. Okay, same thing in anxiety attacks and pulmonary embolism as well. Okay, so now let's move on to a slightly more difficult one. So you'd have metabolic acidosis. So with metabolic acidosis, you have two types. Okay, you would have your high anion gap metabolic acidosis, and we'll talk about the normal anion gap metabolic acidosis as well. Okay, so in high anion gap metabolic acidosis, what would happen? So we said acidosis, you would have a decreased pH. Okay, and with the acidosis, what would happen? You would have not CO2. Remember, we said CO2 was to do with the respiratory system. So what would happen over here would be your bicarb. Your bicarbonate is your major player in your metabolic acid-base derangements. Okay, so in decreased pH, you would have decreased HCO3, which is your bicarb. Okay, now bicarb is a alkaline substance. It is a negatively charged substance. Alkaline. So in this case, if it's acidotic, you would have lower levels of alkaline substances. You would have lower HCO3 with a low pH. Now, what causes high anion gap metabolic acidosis? The mnemonic you can remember would be mud piles. Okay, so with mud piles, think of it this way. With mud piles, you're piling it up. When you're piling it up, there's high anion gap metabolic acidosis. Okay, so let's go through this. So M would stand for methanol poisoning. Okay, so with methanol poisoning, okay, what happens usually, it's when people sort of ingest methanol, what happens is that there is formation of its metabolite called formic acid. When that happens, the major side effect is blindness. Okay, so blindness is the key to identifying this. Another thing you would also notice is an osmolality gap. Okay, with U, you would think of uremia. Uremia is seen in chronic kidney disease, for example, patients who are non-compliant with metabolic acidosis, as well as an example. Patients who are non-compliant with hemodialysis, you would find uremia as well, which can cause a high anion gap metabolic acidosis. With D, you would think of DKA. Okay, in DKA, diabetic ketoacidosis. Okay, with P, you would think of propylene glycol toxicity. Okay, propylene glycol toxicity. You see this in things like using antifreeze solutions. Okay, with I, isoniazide and iron tablets. Okay, now isoniazide is a very important anti-tuberculosis medication with many side effects. Okay, so with isoniazide, particular thing to remember with side effects include things like peripheral neuropathy, it can cause high anion gap metabolic acidosis, it can cause sideroblastic anemia, it can cause vitamin B6 deficiency, okay, and it can cause sideroblastic anemia and hepatotoxicity as well. Okay, with L, you would think of lactic acidosis. Now, where would you see lactic acidosis? Most commonly in conditions like sepsis. Okay, sepsis, you would see lactic acidosis. Now, we all know about lactic acidosis when when we're exercising or we're working out somewhere. We're using our muscles too much. There's anaerobic metabolism going on, causing lactic acid buildup, causing lactic acidosis. In sepsis, it's a hypermetabolic state. There's hypermetabolism going on. You have more anaerobic respiration going on, which causes lactic acid buildup, causing lactic acidosis. With E, you're thinking of ethylene glycol toxicity. Okay, now with ethylene glycol and propylene glycol, you would also notice an osmolality gap. But how would you differentiate between ethylene glycol and methanol poisoning, for example? Methanol poisoning is to do with blindness. Okay, so a simple way to remember that is methanol, me. So you get methanol poisoning when you see me. So seeing someone, blindness, eyes. So methanol poisoning, blindness. Ethylene glycol is more to do with kidney damage. Okay, will cause kidney damage. This will also have an osmolality gap. And finally, with the S, you're thinking of salicylate toxicity, but this would be late. Okay, this would be late salicylate toxicity. So, as we said, in respiratory alkalosis, you'd see that with early salicylate toxicity, and you would see high anion gap metabolic acidosis with late salicylate toxicity. Symptoms of salicylate toxicity include things like tinnitus, headache, nausea, vomiting. Okay, so these are high anion gap metabolic acidosis conditions. Okay, now if we're going to normal anion gap metabolic acidosis, okay, we would see the mnemonic to remember would be hard as G. Okay, hard as G. So how would you see normal anion gap metabolic acidosis? You would see it in things like hyperchloremia or hyperalimentation. Okay, you would see it in Addison's disease. So Addison's disease, primary adrenal insufficiency. For R would be renal tubular acidosis. Obviously, renal tubular acidosis has type 1, 2, and 4, which we have to know, right? For D, you'd see it with diarrhea. Okay, so hyperchloremia, hyperalimentation, Addison's disease, renal tubular acidosis, diarrhea. You would also see it in acetazolamide use. So acetazolamide is used in things like high altitude sickness. It can also be used in conditions like idiopathic intracranial hypertension as well, and in glaucoma sometimes too. With the S, you would see it with spironolactone, which is a potassium-sparing diuretic. So remember, an important side effect of spironolactone would be high potassium levels. With the other S, you would see it with saline infusions. Okay, and for G, you would see it in GI, gastrointestinal fistulas, okay, such as your pancreatic fistulas. Okay, so these are important causes of normal anion gap metabolic acidosis. Okay, now with regards to our final one, which would be your metabolic alkalosis. So in metabolic alkalosis, this would mean you have increased pH levels, and like we said, the bicarbonate molecule is a negatively charged, it is a more alkaline molecule. You would see increased levels of bicarb. Okay, so the mnemonic to remember over here would be halv. So obviously it's spelled with an E, but HALV, half. Okay, half. So for H you would see it with hyperaldosteronism. Okay, hyperaldosteronism. A would be in antacid use. L would be for loop diuretics. Okay, and V would be for vomiting. Okay, so these are the causes of metabolic alkalosis. The best way to sort of tie this all in together, with vomiting, you vomit, so acidity, antacid use as well. Okay, so that is a good way to link these two. Okay, so these are the general causes of each of these acid-base derangements.